understand, like, when it comes to Europe as a medical tourism destination,
Yeah.
it's considered among the favorite medical tourism destination. And what role telemedicine is playing when it comes to medical tourism?
Medical tourism is indeed dominant in some European countries. But funny enough, it's more outside of Europe that medical tourism is developing. The Medical Tourism World Association has developed far bigger and is more active than any telemedicine association in the world. Again, telemedicine is one of the tools they use, whether it's through the patient records, whether it's again to the tools they can use to cover the distance, or once the patient is back at home or before he comes to the destination. But don't underestimate the role of a country like India, for example, but also Thailand and Turkey, which are not necessarily European countries. Europeans rather come to those countries on holiday and, by the way, to have some medical treatment. But of course, medical tourism is worldwide. So, but I wouldn't say that Europe is dominant in that.
It's not dominant, but the telemedicine, does it play the role of that?
Sure, because you need it. It's the tool.
Yeah. So my next question is that, what's, according to you, what's a rough estimate? What's the percentage of telemedicine when it comes to European healthcare system?
That's a very tough question because figures could be anything, and it will be more developed in one. I said before, there's no way back, so it implements more and more because you can't ignore the modern communication tools, and therefore, and whether you call it telemedicine or mHealth, the use of the smartphones and the iPhones or whatever it may be is now developing in very fast pace. So
it's
probably yes.
So I would like to understand from your practice, like how you've been dealing the chronic disease management using telemedicine.
Well, I myself am not a doctor, so I can't talk from a practice. But there again, chronic diseases being more than 70% of the cases, telemedicine playing a role in the treatment or the prevention even. So there again, it plays a major role in the chronic disease sector. And there again, there is no way back. And let's see how it develops further. We'll see.
So, in many other European and other countries, probably where you consult with, do you find that broadband is a concern or challenge when it comes to telemedicine?
Take away the communication part, and there is no telemedicine. As a matter of fact, before medicine, there is tele. And tele means the distance covering, whether it's through broadband, through whatever mean of communication. Let's not forget that it was the International Telecommunication Union that was the pioneer in telemedicine, long before the World Health Organization, because the sector of the communication in those days, mainly the telephone companies in the ITU, were looking at the applications that could go, or by the use of in health, by the use of telephones. And broadband, of course, you need it. And if you don't have that, what is it? Satellite, but that is very expensive. Internet, well, it's true that communication through Skype could be, but there again, you need internet connection. You need still, and it is, yes. So, yeah. But the optic fiber cables that are accessible, but they don't cover the entire world. I would say yet, because they can be used also for other applications than health. So if they exist, health is certainly a sector that can take advantage of it as well.
And Doctor, second last question. What you would like to tell about the data security and the patient privacy when it comes to telemedicine from your perspective?
I think personally that it's exaggerated. I always think about, if you are present in the pharmacy and people in front of a lot of other people waiting are going to explain to the pharmacist that they have pain here or there or whatever, hey, come on, where's the privacy there?
That's true.
And this happens everywhere, every day. Now, that doesn't mean that I want everybody to know my health record. And I think there's probably more protection with the cyber filing than the paperwork that you can enter any hospital, go to any of the offices. It's no security. You can just grab it. So where's the difference? It's just the mentality. Now, there is reason to be careful about this, and it is important, but let's not exaggerate it. We give or bank account numbers or credit card number for transaction, without bothering that people could abuse it. There is always going to be abuse and the risk for abuse, but I think there are systems that can keep it into acceptable norms.
Impressive. Okay. And the final question, which I told that's my favorite question, and it's a general notion. It's not mine. There have been some instances where the doctors have been reluctant to use telemedicine, fearing it might lessen their authority by making it easier for patients to take advice elsewhere. Do you come across such kind of concerns from physicians, or do you think it's a bookish?
Look, the good news there is that generation is disappearing. I won't be there in 30 years. My generation is disappearing. It's going away. And is being replaced as we speak by the younger generation. The younger generation that can't even use a pen anymore. So no longer prescription as it used to be. They'll do it that way,
Agreed.
And therefore they will automatically be open to the little thing that we saw with the baby, and the smartphone, crying if it doesn't have the smartphone at an age of what is it, a year and a half. I mean, this is what's happening. But therefore, it's also very important to stress that it's going to be part of the education system that has to evolve. Medical schools, as it was till more or less now, was about medical issues from the first year. There were no courses in the tuition around technology. Well, that has to be integrated in the medical schools from day one.
Day one, okay.
So that at least the next generation, and not only the doctors, the nurses, same thing, in all the healthcare professionals. You cannot, in a business, we are confronted every day, with the use of computers. We can no longer work as we used to do with a typewriter, not even electric, and with carbon paper and that sort of thing. It's over. It's passé. So education is, in my opinion, going to be the key factor for that evolution. And when the young generation being placed, well, they probably go even the next step. God knows what, I don't know. But I'm confident that that's the way it's going to happen.
Perfect. And that's indeed a good insight given to me. I keep reading about it. So what you mean is that get technology into the medical system, the school.
Absolutely. That doesn't mean that doctors have to become engineers, but that also doesn't mean that engineers have to become doctors. But if you are in the field of health, you need to have at least and realize that it's about the citizen, it's about the patient, it's about ourselves, And that is a major difference, and we have to keep it human. We should not, whether it's the professionals, be dominated by the tools. If we let that happen, I don't want to be part of that life. Honestly not.
Amazing. Thank you very much indeed. It's been
My pleasure.
Great insight. I've been talking to a lot of people, but the last thing what you gave me is good. I wish that there are the people who are sitting in for creating the reform, they could